I want to ask you, Jan, if I may, about your working with Leukamie-Online. You're a computer person. You have a history of knowing a lot about things like mobile phones and how you get information around. What is the scope for cancer information and the internet? And is it being underused at the moment? Have we reached the optimum point, or what?
I think it's going to be very exciting what we're going to discuss at the conference, and this is basically pioneering something we haven't done at kind of conferences before, because everyone's talking about the internet, but people are mainly using Google to find things out, and people need to understand how to utilize that technology better, both doctors and patients, because Google is probably not the only solution. And that's why in this session we're going to have very exciting speakers. So from a patient organization talking about social media, from a patient organization talking about how to run mailing lists, and also from EuroCancerComms creating something like a super portal functionality for health information on the net.
Is there a role for social media in this?
Absolutely. I mean, it's heavily used by different communities already. So patients are meeting on the internet, patients use discussion forums, hematologists all across the world share best practice on difficult cases in their disease area. I mean, email is prevalent everywhere and is a poor tool for collecting information and storing information. So there's a lot of movement at the moment.
So Facebook and Twitter, for example, would be ways you can get what seems to be frank information straight from the heart.
Sure, and it moves the masses. I mean, there's a lot of disease awareness campaigns in cancer being run solely on Facebook, recruiting volunteers for running conferences or making screening programs more known. And so a lot of things has happened.
There's one topic we haven't really looked at very carefully yet, and that is the elderly, another special group who perhaps are underrepresented. Often we take for granted that elderly patients, older patients may get cancers. Is that a particular issue at the Stockholm conference?
Well, they'll be well represented because I'll be there, and I had my 60th birthday only very recently. The increasingly older people are marking their place when it comes to health information and so on. And the politicians are starting to listen more to them than they ever have before. And of course, we are an aging population. Of course, cancer, unfortunately, tends to increase with the risk as age progresses. And very interestingly, when we talk about the internet, you know, for a lot of men, cancer is a stigma. There's a stigma, associated with it, and the anonymity of the internet, where they can go into the internet, find out information and so on, is very attractive to a lot of men.
And Ellen, because many people survive a normal lifespan with cancers like breast cancer, many of the patients are older. Is that a particular issue?
Is absolutely an issue in breast cancer, because the incidence in breast cancer is the highest between 60 and 70. So I think, yes, that's a very important issue, and we know from studies that the elderly for breast cancer are undertreated, that they don't get the treatment they deserve, and they deserve not only for the mortality risk, but a very important thing is that the quality of life. You can improve the quality of life tremendously by getting the right treatment.
And computer services, though, Jan, I must ask you about this. They are so wide. How do we ensure that we get reliable information online and that we can trust it?
Well, more and more there's peer-reviewed information online on the internet, and portals that are collecting information from trustworthy sources. There's accreditation of websites and so on. There's a lot of methodologies and tools that make, let's say, that give a seal or quality seal for websites. But at the same time, the wisdom of the crowd basically decides it as well. Because if information is not right, people will just tag it as being unreliable and will just disappear from many portals.
And serious gaps that any of you think need to be filled by the forthcoming Congress? The patient track in it?
Well, one thing I think we really need to look at is not just the plus with the internet, but also the minus. I mean, bad information is still out there without a shadow of a doubt. But probably more importantly, counterfeit medicines are on a massive rise. And certainly for people who can't afford medicines in the developing nations and so on, the internet is very attractive to be able to buy medicines without having to go and see a doctor. It just comes through the letterbox. Hey, these things very often either do no good whatsoever or they can actually harm you. And the very least it'll do to you, it'll take your credit card details off you. So counterfeit medicines are a big issue to do with the internet.
So what would you all like to focus on, just to leave us with the key points?
I think it's very important that we have a lot of doctors and a lot of patient advocates coming to that conference, because the strength of the conference that we get those into a room discussing issues of joint concern, and then find solutions how we approach it. How do we approach the internet? How do we approach ethical issues? How do we include patient groups in research? How do we solve ethical issues? I think there's so much which is of core interest to everyone involved in cancer.
Ian, what's your
Well, I might
take-home
be a
message?
little bit more lateral on this. I want people to enjoy this. I want them to really enjoy going to a conference of such stature and meeting people that you've always wanted to meet and talk to, and not least to go to Stockholm. Stockholm is one of the most beautiful cities in Europe. Now's a chance to see Stockholm and at the same time get the light in your eyes about cancer.
Well, thank you all very much indeed. It's been great to have you on eCancer TV, and we all look forward to the ethics part of the patient advocacy track in Stockholm.